The development of acquired resistance in patients receiving EGFR TKI for exon 19 or 21 mutations is virtually inevitable. Usually at 8, 10, 12, 14 months, the initial response will start to lag or stabilize, and then we may observe disease progression, often at the initial sites of documented cancer, but sometimes elsewhere. This is a rapidly emerging clinical story. It's really in the last 2 to 3 years that we've recognized the importance of T790 as a mechanism of resistance for those who had previously responded to EGFR TKIs. Initially, it was thought to constitute maybe 40 or 45%. Now, in more recent studies, it's predominant. It's at least 60%. Fortunately, for the patients, we've seen the emergence of at least 2 compounds, probably several more, but 2 that we believe will be commercially available soon that specifically target T790. They also target the original EGFR mutations, the activating mutations, and somewhat spare EGFR wild type. So these compounds, we tend to see a lot less in the way of diarrhea or skin rash as opposed to the initially approved TKIs. Both rosiletinib, also known as CO1686, and the AstraZeneca compound AZD9291 have shown tremendous activity in this area with response rates of 45 to 60%, often quite durable, in some cases more durable than the original response to first-line TKIs. And again, there are several other experimental agents that are being investigated that seem to hold similar promise. And of course, the next step is to compare these agents in the first-line setting to the established first-generation TKIs. As a corollary to this, there are other mechanisms of resistance. For instance, HER2 amplification has been observed in anywhere from 4 to 12% of individuals. There may be a role for afatinib or neratinib or some of the monoclonal antibodies that target HER2. That really needs to be established further. There's the emergence of c-Met amplification, again, compounds that specifically target that mechanism of resistance. And occasionally we see complete histologic transformation from non-small cell to small cell carcinoma of the lung. It's pretty rare. Initial reports suggest it was 10 to 12%. I think the real percentage is closer to 2 to 3%, but it underscores the importance of rebiopsying these individuals when they develop progressive disease.